Good afternoon. I want to welcome all of you to our second virtual town hall meeting today. I really thank all of you for being a part of it. And if you're returning for the today, obviously it'll be a lot of the same information, but certainly appreciate if you were part of this morning your feedback and input as we're really learning how to engage differently. And I know you are, whether you're working with students or whether you're doing your office work on a day-to-day basis. We've all had to make transitions, and the work that you've done in making that transition has been absolutely remarkable. I just want you to know how much I appreciate it, but more importantly, how much our students are really appreciating the feedback that we're getting from students, as they really do appreciate and understand that the world has changed, but because of your work, they're able to continue their pursuit of their degree. And I should point out, when this first happened, we had several students that dropped their courses just assuming they wouldn't be able to go on. And when we reached out and talked to them, they've come back, they re-enrolled, and are continuing on. And again, thanks to you and your support. You know, today I really want to be able to shed some light on where we are as a district, some of the work that we're doing to manage through this unprecedented crisis, and then what we're going to do beyond, because I think we all have to acknowledge that certainly we're dealing with it today, but this has changed not only us, but our community, our students, and our entire country and economy. So we have a lot to cover today. Want to address as many of your questions that you sent our way as possible. And thank you, by the way, those of you who have continued to supply questions. I was reviewing them just a few moments ago, and we'll do our best to answer those and to respond. And obviously, it takes a number of us to really take care of all that. So I'm glad to have with me today a number of the leadership team joining me. Justin Lonan, our Executive Vice Chancellor, he's going to be guiding today's conversation and to make sure that we stay on track and adhere to the time frame. Linda Brady, who is, of course, president of Brookhaven College, but also serving as our interim provost. Dr. Joe Seabrooks, who's president of Cedar Valley College and the interim vice chancellor of Student Success. Sherry Enright, who is our chief human resources officer. Iris Freeman, my chief of staff. Rob Winland, our general counsel, and Piper Wilkins, who heads up our foundation and advancement work for the district. Again, thank all of you for joining us. I really appreciate your engagement today, and look forward to this being a productive hour. And with that, Justin, I'm going to turn it over to you.
Well, thank you, Dr. May. And again, thank you, everybody, for being here with us today. So as Dr. May said, we have a number of questions to try to get to. But before we dive right in, you know, there have been some questions that just, you know, kind of focus on the current reality we find ourselves in. And Dr. May, I know that day to day you're engaged in conversations with local, state, federal officials. And can you just share with us a little bit your perspective on where we are right now?
Sure, and appreciate that. You know, it's been a learning curve for me, quite honestly. I never thought I would need to know this much about community health, public health, the impact that it can have not only on individuals, but our community and our society in general. And when we started down this journey, it's just hard to believe. It was right around when we started hearing about it at the end of January, February, and then got serious here locally around the first part of March, that how much a community of us have learned together. I just this morning, I was on the phone with Judge Clay Jenkins and T.C. Broadnax, city manager of Dallas, Michael Hinojosa, superintendent of schools, Gary Thomas with DART. A part of that has been Fred Cerise with Parkland as well. Yesterday, with Harrison Keller, the Commissioner of Higher Education, Mike Morath also yesterday, the Commissioner for Texas Education Agency. And we've all been learning and sharing together as each of us in our own way are looking at sharing what we know, but also how we translate that to our specific communities and the students, the employees, those that we serve. And certainly one of the things that I've learned is that the trajectory of the pandemic is really different in different countries, and it's playing out a bit differently here. It's really based upon the degree of isolation that's taken place, those measures and how they've been enforced, as well as just some of the properties of the virus itself. We know that in some areas like South Korea, they have started strong, but then have sustained a decline going forward. Other areas like Beijing, Shanghai, elsewhere, even in the U.S., we saw it start kind of level, and now a resurgence again as we see that. And certainly we do know that the shelter-in-place rules are working. The whole goal of that you hear them talk about flattening the curve, what they're really talking about is keeping the new cases low enough that it doesn't overwhelm our hospitals and healthcare systems. How do we just simply have enough beds to accommodate those that become ill? And that's really been the short-term goal. We do know from historic outbreaks like the Spanish flu or MERS, many of these outbreaks occur in multiple waves. And we fully expect that could happen here. If you've heard the experts, that's kind of what they're saying, is that we can see as many as 3 waves going forward. So as we look at that, we're learning, we're trying to understand the modeling that's going on and making sure that we don't inadvertently contribute to the problem. And that's why we've been supportive of the lockdowns up to this point, to really avoiding a new flare-up and support efforts to contain that. You know, I know, that being said, it is frustrating for some of you, challenging. There's a sense of loss. You know, I don't know about you. I miss seeing grandkids and other family members as well. And I'm, you know, I realize that to a certain degree, we're going to be in this situation, I believe, until there is a reliable vaccine in place. Otherwise, we'll continue to put people at risk going forward. So how long will that be? I don't know. You know, we said that from the beginning, that as we got into this, we initially, was it going to be a week? Was it going to be 2 weeks? But then it looked like it was going to be 3 and 4, and we continue. Now we're in a shelter in place till April 30th. But I can tell you from conversations I've had the last 24 hours with healthcare experts and others, I believe that's going to be extended. How far? I don't know. Will it be 2 more weeks, 3 weeks? I think that's yet to be determined. But clearly, that's the landscape in which we're all operating. And I appreciate that this is not something we signed on for when we started this fall semester, but it's the reality, the normal in which we're going to be operating through the end of this fall semester as well. So that kind of gives you a status of where we are right now. Thank you.
Thank you, Dr. May. Let's dive in a little bit deeper. You know, obviously, everything you just said, there's some specific implications on the district and on employees, and they certainly have plenty of questions about what all of this means. And when this started, you moved very quickly to organize some rapid response teams and to begin to think about this work a little bit differently. But, you know, can you kind of give us a snapshot of the impact of all of this on the district?
Sure. You know, and again, when we started this, which was right before spring break, we called an immediate, emergency meeting of the Board of Trustees on March 16th, which would have been the first Monday of spring break, when we realized that the world had just completely changed. And while it wasn't overnight, I think our understanding of the reality was fairly quick. I recall when we set up the meeting, which would have been about Thursday of the week prior to that. Between then and Monday, everything had changed. Even some of the reasons we'd called the meeting had changed as a result of that. And we really didn't know what was going to happen, but we knew that we didn't have enough time to get ready. to move everything online, which we announced at that Monday, March 16th time that we would do that. So we took that additional week to get ready. And what we did during that time was to really appoint a transition team that was responsible for 6 distinct areas that we needed people to work through. That included things like the academic side. How do we identify the courses that can be moved online, and how do we support faculty and train where they haven't done that before? What about student success? The other side of that, our students, how prepared are they? What do we need to do to help them? Our employees, a team around supporting our employees to working remotely, looking at what's going on from an operational standpoint, our budgets consideration, all the things that we need to have in place, and perhaps among the most important, our communication strategy, knowing that this was going to be changed, knowing that we could say something one day and completely reverse it the next day. And how do we do that in a way so that everyone understands why that happened, but also understand the new information that was out there? And I'm so incredibly proud of everyone, but I want to really single out a couple of people. Dr. Brady, who jumped in as interim provost. As you know, we are moving toward the one college, and I'm sure I'll talk about that later today. But as we are doing that, we had a structure in place. It was logical to go ahead and implement that structure on an interim basis, and with zero notice, Dr. Brady stepped up, agreed to do this, and coordinated so that we would be able to act in a uniform way at all campuses, all locations, with all faculty and with all students as it relates to the program. And then Dr. Joe Seabrooks, who likewise did the same thing as it relates to our student success, finding ways to support students, call students remotely, coming up with ideas that we had never done, never thought of, and both of them doing this incredibly rapidly. And I want to just thank the folks that have supported them, because I know that they've been holding team meetings daily throughout this process. They've drawn from their staff, but they've also drawn from people across the entire district. And so I'm just, let me kind of comment one thing that's a little off, but I think it says a lot about who we are. We've been supporting our own community that's hurting as well. I think our colleges who very quickly found every single glove that could be donated, every surgical mask. We've put up ventilators. We've offered hospital beds. People donated time. We've made and produced at scale masks or the face shields. They're going to UT Southwestern and other hospitals as well. We've also created on SharePoint a whole host of resources that are available to employees. We've put in place toolkits to help while remote working. So everybody has come together both to support ourselves internally and externally as we've done that. So I really appreciate those, specifically Dr. Seabrooks and Dr. Brady, for really helping our faculty and other employees that are working directly face-to-face with students. How do we do this in this particular environment? So thank you for that.
Thank you, Dr. May. Well, along those lines, Dr. Seabrooks, talk to us a little bit, if you will, about what we've done to reach out to students with this amazing team that you've been leading.
Great, thank you. We have had really 4 areas that we've stood up. The assessment and tracking of students, helping our employees, our professionals work virtually, and setting up a virtual student resource center. How do we engage students who have gaps in employment, and then how to really communicate that in a consistent way. I will invite Piper and Iris to jump in, but I know there's been some incredible need that has been identified by students. And as a district, we've set up, we've really stood up to support them. And so, for example, our food pantries, which we can't operate, have been able to make their inventory available to our regional food banks to make sure our students can access those resources. I know that there are gift cards that have been made available for students to access as they have needs. And then, of course, the emergency aid program has been absolutely monumental in helping students stay engaged. And so we are learning on a daily basis some of the challenges students are facing and doing our very, very, very best to meet those needs.
Thank you, Dr. Seabrooks. Dr. Wilkins, Dr. Seabrooks was referencing the emergency aid aspect of what's going on. Can you share with everybody a little more information about that?
Sure. So we launched our emergency aid fund really back in the fall when tornadoes came through Dallas and caused problems for a lot of students who had a lot of emergency needs at that point. We work with a company that helps us make this really easy for students. It takes a student less than 5 minutes, maybe around 3 minutes even, to complete an application for emergency aid. They have an answer within 24 hours and can have emergency funds in their account within 48 hours. So this is truly a situation where we can help students quickly, we can get them cash so that they are not struggling like so many people are right now. That has seen a dramatic increase in the number of applicants recently, but we've had really some tremendous support. Our foundation board voted, I think it was spring break week or right after that, to infuse our fund with another $1 million. So we have our own resources, but very soon we will also have some tremendous resources made available through the CARES Act. And I think somebody else may talk more about the CARES Act in a little bit, but on the emergency aid side, we will have a tremendous number of dollars available that will be able to help even more students.
Great, thank you. Dr. Brady, obviously this transition, faculty had to move very quickly, and they've done an outstanding job of moving their classes to an online format. But we've certainly had some questions that have come in asking about technology issues that faculty may be facing, and also concern about their students. You know, things like students may not have the right technology, or students, you know, English may be their second language. So talk to us a little bit about what help is available for faculty on that front.
Yeah, we have some amazing staff members in our instructional technology support areas who can help faculty one-on-one with technology challenges. They can even log in to a Blackboard session that faculty have going on with students and assist in real time with any kinds of issues that are going on. Our faculty leadership group has also established this faculty buddy system, which I think is really cool, where they're connecting faculty who are experienced in online instruction with those who are new to it. So the resource that's online for you is the Faculty One Stop page on our website. And when you go to the SharePoint landing page over on the right-hand side, you'll see Faculty One Stop. And if you sort of explore in there, you'll find several points of contact for specific people that you can reach out to and request assistance one-on-one. There's all kinds of training options there. There are webinars that are recorded. There are live ones going on. And so if you need any assistance with any of those things, you can also reach out to your local faculty association president as well, because they've been working aggressively to get support for faculty as well.
Great, thank you. Dr. May, I want to go back to something you referenced a few minutes ago. So get out your crystal ball here, because we had lots of questions about when we may return to normal. So, you know, give us a sense of how long you think we might be in this remote situation.
All that.
Dr. May, I think you're on mute.
Oh,
there you go.
Okay, there we are. Or somebody get me. Thank you. The little red dot's supposed to not be red, I guess. So thanks. Appreciate that. You know, I really wish we did. You know, as we started into this, I didn't know if it was going to be a week or if it was going to be 2 weeks. We knew we needed to proceed with the caution as related to people's health, and we would take conservative action as we looked at. And certainly, as I mentioned a few moments ago, the flattening of the curve. Right now, we know, of course, is shelter in place through April 30th. But as I kind of alluded to, the conversations out there are that's going to be extended because we're not seeing the decrease yet in the risk. And I think it's going to be still some aspect of this much longer term than perhaps we've talked about, simply because until they really get that vaccine perfected to where enough people either are vaccinated or have had the coronavirus, that it's safe for the rest of us to be out, it's going to be problematic. Now, while we have talked about Maymester and summer there, and I want to get into a couple of things related to that, you've probably seen, it's been unavoidable if you've read the higher ed publications or watched CNN or Fox News, that universities elsewhere in the country have announced that they are staying online only for the fall semester. Some now have announced as recently as yesterday that they're going all next year, all the way through May of 2021 online. Obviously, that has real implications for our particularly CTE, those that have lab requirements, those that require hands-on work of students. And let me go ahead and address something, some of the questions that have been related to that, if I could, while I'm here. You may see that across the state, those of you that are in labs or are running those programs, you may hear from your colleagues that they are holding lab sites, maybe restricting that to 10 people. They're taking their temperature when they come in. They're sanitizing after every use. They are limiting it to folks 10 or 13 feet apart, depending on what they've decided to implement. Some are actually doing it one-on-one with faculty members that are there. However, they are under a different set of rules than we're under today. Our stay-at-home guidelines mean stay at home, and that is why we've had to identify only those individuals that are essential to the ongoing operations, that being in IT, that being in facilities in that area. So we have 183 that I've had to issue a letter to. So when they're stopped by the police as they're coming to the campuses, that they fit into that category. Otherwise, everyone else is to stay home in Dallas County. So I think at some point down the road, perhaps we'll still see some version of restriction and social distancing, but allow some of these to meet if we follow CDC protocols, as I said, such as taking folks' temperature, determining, sanitizing, and following up. I don't know when that will occur, I'm convinced it will at some point in the future, whether it'll be summer or fall or when. But obviously, as soon as it is, we'll be communicating and talking about that new piece of information and our new opportunity there and how we deal with that going forward.
Well, thank you. Well, certainly at some point the order will be lifted and we'll return. And so, you know, Sherry, as our new Chief Human Resources Officer, I know you've been fielding a lot of questions about what return might look like. So give us some thoughts of what that transition may look like ultimately.
Sure, and thank you for that. Well, as we've been discussing on this town hall, we have made a lot of adjustments as a result of the COVID-19 pandemic. So obviously, you know, we continue to monitor those adjustments as well as all available information to determine how we might get back to our guidelines and how we might implement whatever CDC guidelines that are in effect at that time, such as we've talked about, social distancing in the workplace. Can we stagger schedules? Will we come back wearing masks? So we continue to keep a very close eye on that and work for a plan as to how we can best do that in accordance with the CDC guidelines as they exist when we can come back.
Well, thank you. Dr. Seabrooks, let me turn to you again if I could. Again, at some point we'll come back, whenever that may be, but we know that in the meantime we've had to cancel student events and some of those things that students look forward to. So you referenced a little bit earlier, but share with us again in some detail some ways we're working to make life easier on students, and then just how this crisis has impacted how we do student services in a remote environment.
Well, the first thing that we were able to do collectively was to bring the teams together to ensure that the students were having a unified experience. And in that unified experience, that means that we stood up a virtual student resource center, as well as down the line we'll be developing more high-tech, high-touch operations to meet the students' needs. And so I'm thrilled about the future of student development. Right now, we have very limited, only face-to-face, in most cases, interactions. But from a moving forward in the future, we will definitely be moving more virtually. I'm excited about the prospect of competing with institutions that we've never competed with before, like the WGUs in the world, accessing a different student.
Thanks, Dr. Seabrooks. Dr. Freeman, let me ask you, I know you've been working with Dr. Seabrooks and his team, really focusing on the mental health aspect of our students. And can you share with us a little bit what we're doing to provide support along those lines?
Yes, Justin. You know, the concern for mental health among students is rising. And so we have collectively come together to make sure that we're able to continue to offer the high quality service that we're able to offer face-to-face in our virtual environments. All the counselors and the care team and the nurses from all 7 colleges have come together and been able to come up with a couple of tools that we can use to provide mental health support for our students. We know that that is critical to them being successful. Our students have been able to use our virtual resource center that was launched on April 6th, and we've had over 500 visits to just the counseling, care team, and wellness page, so we know that there's a great need. And we're also implementing a Talk Campus app, which is a peer-to-peer mental health support app that involves students being able to anonymously and very comfortably have a conversation about many of the things that they're facing right now mentally, and need be, there's also a connection for them to get services in the area in which they live, along with a professional that can reach out to them. There's an algorithm involved that will alert the professionals on whether or not the student needs additional assistance before they move to crisis mode. The app also has bilingual support, so it literally is available for all of our students. Telehealth modality we've moved into so that our counselors can continue their one-on-one engagement with their students, allowing the care team as well to use to facilitate group support sessions in these very challenging times. And then we also have added therapy assistance online. Now, this particular software allows us to support individuals that are in an unsafe living environment or that cannot avoid the stigma that goes with reaching out to help. And these are self-help modules that cover various mental health topics, and it just allows them to carefully and very privately get the assistance that they need so that they can be supported as well. Additionally, we have decided to continue our mental health first aid training, so that's great. And so all of the people who haven't had the opportunity to take advantage of that training, please look for any announcements coming out regarding that training schedule, because that's the way that we collectively can use the tools that we learn in that training to support our students' mental health. And then lastly, our nurses. Many times nurses and health professionals are looked at to be a support for our mental health students as well. And the nurses have put together or established a DCCCD healthcare line, and it's operating daily from 8 a.m. to 8:30. And those students that reach out to them, the nurses are partnering with the counselors and care team to provide them the direct connection to getting them those resources that will help them during this time as well.
Thank you, Dr. Freeman. Dr. Brady, I want to go back to something that the Chancellor was referencing a few minutes ago about the difficulty of a number of our programs that typically require, hands-on experience, labs, and the difficulty of those programs like nursing and welding and others. And I know early on as we were making this transition, we were having to get fairly creative. So can you speak to that a little bit of how we've supported these programs in a virtual environment?
Sure. Our academic vice presidents and deans are working with faculty currently to evaluate online tools that are available for simulated experiences and virtual interactions with students. And we're also currently working with Tim Marshall and John Robertson to secure software applications that have already been identified by faculty as useful for their classes. So that's a specific way that we're supporting them. And the reality is that we all know that for many programs, as Dr. May mentioned, there is no real substitute for the face-to-face interactions in a lab environment or a clinical environment. And so faculty are just having to do the best they can in this unusual circumstance to deliver instruction and to address as many student learning outcomes as they can during this semester. And so, it's probably going to be that in some cases, we'll have to award incomplete for students in some classes and then finish up the hands-on portion of the classes in person later on, whenever that ends up being that we're able to come back to campus in some measure. So we're always looking for additional ways that we can provide support.
Well, thanks. Along those same lines, we've had a couple of questions that I'll turn to Rob Wendland because it certainly impacts the law enforcement side of things and it intersects with the academic side as well. But Rob, we've had questions about, would we consider allowing our college police academies, like some others in the state, to open up face-to-face for face-to-face instruction using enhanced social distancing and ramped up protocols?
Thank you, Justin. That's a really good question. It's a tough question because, first of all, we really have the greatest appreciation for law enforcement and all of our first responders as they're helping grapple with this coronavirus. And we really want people to be able to complete their training and pursue their career in law enforcement as soon as they're able to do so. But as Chancellor mentioned earlier, we're under a very stringent shelter-in-place order right now. And in many respects, the order in Dallas County is much more restrictive than other counties. So we even have a different reality than some of our neighboring counties. The law enforcement academies are governed in part by the Texas Commission on Law Enforcement. You hear it referred to as TCOL sometimes, and TCOL has put out some limited guidance about law enforcement academies, and in particular, they've said that they're very comfortable with moving to an online format, those courses and parts of the curriculum that can be moved online, and deferring those in law enforcement academy, you have defensive tactics, you have firearms trainings. Those things can only be conducted in person. Similar to what Dr. Brady was just talking about, it presents real obstacles for us. But TCOL has said they're going to extend the deadlines for the completion of that in-person training. It's very important, so they're not going to waive that requirement. But certainly, we're seeing examples of law enforcement academies and police agencies that are still open. Arlington, for example, is still open. They're in Tarrant County. They're under different rules than we are. But more importantly, the city of Arlington, their police department is an essential governmental function. They operate under a different set of rules than we do. We look, Collin College, Tarrant County College, they've both closed their law enforcement academies, as have we. Under the present circumstance, we continue to monitor those orders, and certainly to the extent that they can be relaxed at some point in the future, we'll be happy to offer whatever training we can in those law enforcement academies.
Yeah. And if I might just jump in there again, I mean, we talk about this daily. We've had conversations with the governor's office, with the coordinating board, with certainly I talk to Judge Jenkins more than it's almost every day, not quite daily, but about the issue, but also with our health officials and others. And that's certainly, we understand at the point that we get the clearance, what we think we can do there, and we still want to be sure that we're safe in all aspects of that. So as soon as we get a nod one way or the other, we're not going to keep that secret. We'll let everyone know, and then because frankly, some folks have said they're not sure they're ready to go back, even if they could in those situations. So it's really a balance as we look at each situation and what the needs of the faculty and students and others are, knowing that we've got folks that with some of them because of previous health conditions find themselves not necessarily in a situation where they can deal with that at this time. So there's a lot that we're considering, but bottom line is right now we're prohibited from doing that, but at some point we do think that we'll begin to open up.
Well, and so speaking of opening up, Sherry, let me turn to you. While we certainly have people that are have struggled more to get comfortable in this remote environment, we have others that they're kind of enjoying it and have questions about what remote work may look like in a go-forward basis. So can you share your thoughts on that a little bit?
Sure, absolutely. Well, first I would say we certainly appreciate everyone's hard work in adjusting to working at home in a virtual environment. As you said, it was difficult for some folks, and I know we've all heard about the technological challenges, but we did it in an emergency situation. So for the immediate future, as we start thinking about returning to work, we anticipate that return to work under our current guidelines. However, we have learned a lot of lessons from the COVID-19 pandemic. So we are reviewing future opportunities for certain roles that may be more suited to remote working. But in order to do that, we have to ensure that we have the necessary infrastructure in place to do so. So for instance, the technology challenges are addressed. We have the needed requirements from internet, from device, from hardware, software, those types of things. And more importantly, we have to have in place it's either whether you manage a team or whether you're on a team that gets managed, how do you set your daily goals, your objectives? How do you stay engaged? I know several of us are feeling isolated. So we are certainly taking our lessons learned and we'll determine what opportunities we may or may not have in the future for that.
Well, Sherry, at the same time, let me ask you, we've had a couple of questions that people are not in a hurry to go back for other reasons. They're concerned about the health and safety aspect of it. And so, so one of the questions is, whenever we're able to return to campus, how will we handle sick employees at work?
Well, of course, the district does provide sick leave to its full-time employees, and we always encourage those who are ill to stay at home, especially in this environment. As we've said, it does change daily, so we are evaluating the measures that we can put in place to ensure the safe return of our workforce as well as our students. I did want to briefly mention, as Dr. Freeman talked about, the resources available to our students. We also have resources available to our employees. If you're struggling either with wellness or just need some tips, you can check out our employee toolkit on the COVID-19 page, and then as well on the Talent Central page. There's a lot of good articles and things of dealing with stress and dealing with the health aspects of this as well. But certainly the safety of our workforce and our students is imperative as we look at that return to work.
And I'd like to add to Sherry's point is that as we continue to build support for our students in their mental health, we will always look for those avenues that will support the students and our employees. And so Sherry and I have been able to partner in making sure that we have a robust support for mental health for our employees as well.
Thank you, Dr. Freeman. Dr. May, let's talk a little bit about One College. We've had several questions about the status and kind of where we are in One College. Obviously, we've been working on those plans a great deal. And so kind of give us a quick update on where we are on that, if you will.
Sure, and certainly we didn't anticipate any of this when we started down that road. You know, as just timing would have it, literally at the same time we're calling an emergency meeting of the Board of Trustees. We have to get the paperwork into SACS, our accreditor, as it relates to the transition to one college. And then some of you may have heard SACS then scheduled to meet in June, kick their meetings down the road till August 31. Which was going to create even more havoc for us in that. But they've agreed now to back up, consider our request in June, along with the request for us to be able to offer baccalaureate degrees. So all that transition will take place. Well, if you add up the weeks, that's not much time. And fortunately, as we got into this, we already have the structure mapped out, at least levels 1, 2, and 3, and now we're working on levels 4. So we were able to quickly roll that into place, again, under the leadership of Dr. Seabrooks and Dr. Brady, but others too, because we rolled up HR under Sherry. We've rolled up all of our marketing and communications under Patty. We've finance and business under John Robertson and so forth. So we've taken advantage of that. IT under Tim Marshall, grants under Piper Wilkins. So we'll continue down that road, but that's also necessary as we now move into the June timeframe where we'll be needing to make that move. And so it actually seems that in many ways this has kind of worked out in alignment. I wouldn't want to have this crisis just to go through this process, but the fact that we had started it made it a little bit easier and that we didn't have to invent some of the ways to ensure that we were able to engage all students, all faculty, everyone in the same way. So that is ongoing. If anything, it feels like because of the time frame now, I mean, just literally a few weeks away, that there's a need to accelerate this, and we'll continue now to move on putting people in place to manage that process as we go forward.
Well, along those lines, let me ask you, Dr. Brady, a couple of the questions that have come in are around kind of that structure part in one college, but, you know, specifically ask for programs like nursing that have similar roles but different titles across campuses. What are we going to do to address those differences?
Well, they will definitely be standardized across all of the programs in the new organizational structure. So we don't know exactly what that's going to look like yet. Dr. May just mentioned that we're working on level 4, and so then we'll work on the next level down from there. But whatever it ends up being, it will be consistent across all of the programs for sure.
Great. Dr. Brady, another question that some faculty members have asked is, should they be developing new content to serve students in this online environment in preparation for summer, or should they wait for further instructions related to the one college standardization?
Well, I hear stories every day that exemplify the fact that faculty are working so hard to ensure that our students are still learning in this environment that's unfamiliar to some of our faculty and some of our students. And so faculty are being particularly innovative right now. And so I would love to see us take advantage of this time in ways that could benefit our students in the longer term. So for instance, any work done now on developing new content for an online environment would certainly serve as an excellent foundation for any sort of standardization that might take place for online courses in the future. Particularly if faculty would work now with our instructional technology and our instructional design folks to ensure that they're utilizing best practices and following the latest research about online learning. So I think there's a lot of opportunity to work now toward future benefit to students.
Thanks. Dr. May, let me turn back to you. A couple of questions that have asked, how has this crisis impacted the district financially?
Sure. And great question. And some of it, as you read the headlines of the paper, you see things like the drop in oil prices. Obviously, when businesses close, there's sales tax not being collected as well. We'd probably find on the property tax side, which is really the bulk of our revenue, at least for the short run, but we don't know what that's going to play out for the long haul either. As we look at that, the good news is this year the sales tax was about 13% up on the collection side prior to this event. We had already collected like 98, 99% of the property tax that's there. Clearly, though, this is going to be on the mind of legislators and others going forward as the finances. We're really pulling together various scenarios. It's as we know, there are a couple of things that happen with an economic decline, and we've seen just in a very short window, record people filing for unemployment in our area. Many of them our students who were working in restaurants and other areas of the hospitality industry and other things that had been impacted by this. Some of them in the gigs aspect of the economy and working there. And we know they have been directly affected. Yet we do tend to see when unemployment goes up, and enrollment also goes up at that period of time. So while there's been a lot of our higher ed colleagues talk about they believe there's going to be an enrollment downturn, I'm not so sure that that's the case. And we've not seen it this spring. We're actually have seen greater retention this spring than we did spring a year ago. Summer is still unknown for us as we look there, and certainly fall is unknown, but I'm optimistic. But I think the real issue there is what happens to the overall state budget. And I think that is one that I was on phone calls almost all yesterday and all this morning as it relates to really trying to communicate to the legislature, the governor, and others with Harrison Keller, with the coordinating board, with our colleagues at other community colleges, that right now community colleges are playing a more important role ever in our state, ever in our economy, ever for employers, ever for individuals. And now's the time to really be investing and looking to the future. So I can tell you that's the message we're communicating. I've got sitting here just coming in a screen that outlines the requests that we'll be making during this period of time. And this is not a retreat, but rather how do we advance and move forward, knowing that if we are going through some type of economic downturn, the only way out of it is going to be because we've done the job to prepare people for the jobs that exist in the future. Now, we know one thing happens during these situations, as we saw during 08-09, where you had a lot of people laid off. They called it a jobless recovery, if you remember that term. But what happened was there was a lot of investment in technology, and yes, people got hired back, but it wasn't the same people that got laid off because the skills needed were different. And one of the things that I'm hearing from employers in my weekly call with about 200 CEOs of companies is that they are anticipating something similar. They're talking about that up to 36% to 40% of the people that they have now will have to be retrained to the new skills over the next 2 years. That sounds a lot like what we do. And so I think that's important. So while we're concerned about sales tax, we're concerned about the price of oil, we also believe that the only way that we're going to see the state recover is if there's investments made into your colleges. And at this time, we're not seeing any impact on the property tax going forward. That could change, but that's where we are today.
Well, thank you. Well, let me turn to Dr. Wilkins. As we contemplate and think about the changing financial picture, perhaps, Dr. May referenced earlier that you're helping lead a unified grant focus, and you also referenced the CARES Act. Give us a sense of how you see those being important components moving forward?
Yeah, I think, grants have always been a really important source of funds for our district and brings additional resources to us, and our colleges have always done a great job at looking for those opportunities where it makes sense to use grant funding for certain things. And, I think now our movement to one college and the ability to really do those things consistently, across our system and in partnership with each other. A lot of times, colleges do what they need to do with the grants. And now we're going to be looking at that as one college. So what do we do when we apply for grants that really helps meet the strategic priorities of our district and serve our entire community in a different way than we've done before? Dr. May also mentioned, the increased investments in community colleges that's likely coming. A lot of that will come from federal grants, from state grants. There will be a new focus on job training, and we don't even know yet what those jobs might be, but there will definitely be federal and state funds in the forms of grants that will come to us for that. So it's going to be, more important for us than ever to work together and to manage all of those applications and projects and grant funded programs in a way to better serve our community and our students.
And Justin, if I can clarify, I want to be clear. I didn't say additional funds would be coming. I said that's going to be the ask that we're making during this point in time, knowing that it's going to be a very difficult economic environment. But we do believe this is one of the better ways that the state can invest dollars to ensure that we come out of this in a strong position. And we appreciate all sources coming in. As we know, Dr. Wilkins, we will be getting some federal dollars that are coming in, and hopefully additional ones to support the work that we're doing.
Yeah, thank you, Dr. May. A subtle but important distinction, so thanks. But speaking of the financial side of things, let me turn back to you, Dr. Seabrooks, because we know that there's been a lot of questions about financial aid. And so a number of our faculty and staff have been on the front lines of answering some of those questions, as well as your team. But some of the specific questions we have are, we know that the students are dependent on financial aid. Will dropping a course impact the student's financial aid status? And are there circumstances where they might have to pay that back?
And so thank you for the question. The good news is that, students will be held harmless during this particular point in time. The bad news is, though, we have to make sure that we don't lose students, that we do everything we can in our power to keep them engaged and keep them moving forward. The Chancellor and Piper talked about opportunities. There's questions about the county funding. There's questions about state funding. There's questions about grants. The only thing that we really have control over is engaging our students and ensuring that they have the quality experience that rivals any other experience that they can have. And so as we come together and to continue the tradition that we've had for almost 60 years, we need to continue to make sure that our students have a stellar experience, even though they'll be held harmless from financial aid. But our student experience is the only thing that we have in our favor to get us through these times.
If I could also, just to clarify, Dr. Seabrooks, this is a temporary rule by the U.S. Department of Education to hold students harmless. This is not a permanent change. So is that correct?
That's absolutely right. This is a snapshot in time that was going to protect students, but all of the support that will come our way will be temporary. What's permanent is making sure that we build on our reputation of serving students.
Well, let me turn to Rob. We've had a couple of questions related to the bond campaign. Obviously, that's one of the big areas of community support over this last year, and a lot of anticipation about what our plans are around that. But there's also been a lawsuit around that, and so we've had some questions just asking for an update on where we are.
Yeah, thank you, Justin. It tickles my lawyer heart to know we've had people questioning about the lawsuit, but in all seriousness, I'm limited in what I can say about lawsuits in a public fashion. But Lawyers are subject to shelter in place too, and you know, it's kind of interesting. Some people might think that lawyers having social distance from other people should be a permanent thing, so I'll say that. But you know, we have been working diligently on the election lawsuit during the period of this pandemic. We've been doing so in a virtual capacity, doing depositions by Zoom. About 2 weeks ago, we had a 2.5-hour hearing in Zoom. And being a lawyer who, before I joined the district, I spent years in and out of the courtroom, it's a very unusual circumstance to do things in that fashion. But in that hearing, Judge Stokes told us that we were going to go to trial on June 1st in this case, and that he would, if we were not released from shelter in place, of course, the courthouses are closed, so we can't physically be present in the courthouse at this time, but he said he will conduct the trial via Zoom and told the parties to be ready. So that's what we intend to do. We are finishing discovery in that case via the Zoom capabilities that we have, and all parties are expected to be ready to go to trial June 1st. So, you know, again, that's always subject to some intervention of some order that prohibits us from doing that, but right now that's the expectation.
Well, thanks, Rob. Well, that gets through the bulk of the questions that we have as we start to close. So again, let me thank everybody for participating today. I understand we've got a large number of folks that are joining us, and so we appreciate that. And certainly you may have questions, and so we'll be updating the COVID-19 and the One College FAQs on SharePoint. So keep sending in your questions as you have them. So with that, I'll close and turn over to Dr. May to give us some parting words.
Yeah, thank you so much, Justin, and thank all of you for your continued engagement with students, with each other, supporting the needs of all the individuals that we serve and one another during this time. I hope you'll continue to raise questions as it's really helpful to hear what's on your mind, perhaps what students are concerned about, what do we need to be thinking about down the road. You know, as I've said throughout this, every day has been a new learning experience. You know, we've been on a learning curve to figure out how to deal with this type of situation. And so that your engagement is critical in that. And along those lines, I hope you found this meeting helpful. We certainly are looking forward to getting your feedback on the meeting. Be on the lookout for a survey that will appear on the screen immediately after today's meeting. Really want to hear what you think because frankly, we want to be sure that we're responsive, that I'm responsive to your needs. So take a few moments and do that. You can also find the latest information, as Justin just mentioned, related to the COVID-19 response on our COVID-19 SharePoint site. Take a look at that. Again, if you have a question that's not there, or you think a resource, or you hear about something that someone else is doing that's not there, let us know, because it's really our goal to be thoughtful and to figure out how we can solve as many problems as we can, knowing that there's some we just don't know, we can't, or because of the various rules under which we're operating, we're somewhat limited. But one thing that I think we can all do is be appreciative of those that are working hard, many of them putting themselves at risk, whether it be those in our healthcare industry, our first responders, police, firemen, those who really don't have a choice